Through research, HIV infections among girls and women in the coastal towns of the central region are partly being associated with a practice known as sex for fish and other sexually related issues. Reports say girls and young women are particularly vulnerable to infection with HIV and other sexually transmitted infections because of the numerous transactional sexual relationships they engage in where they have no say or control. Mavis Ofe Champon finds out more.
Sex for fish is a form of transactional sex where girls and women are coerced to engage in sex in exchange of fish. Girls from poor households are vulnerable to this abusive practice as they seek fish stock to sell and fend for themselves and support their families. In Kenya, where sex for fish has been properly documented, poverty among the fishing communities is said to be contributory to this abusive practice. In many cases, girls are exposed to sexually transmitted diseases and HIV infections from multiple sexual partners who take advantage of their vulnerability.
As part of the engagement with these adolescent girls, most of them do not actually have protected sex, and it is not so far from what the Ghana Health Service shares at the various district levels or regional levels in terms of the high rates of HIV and AIDS, especially amongst the youth or adolescents. Poverty indeed is a line that is drawn between both Kenya and Ghana, as well as the fact that there are instances where this is leading to pregnancy on both sides. Again, fish is the major commodity and sex is the other commodities.
The program manager for the National HIV/STI Control Program, Dr. Aisi Addo, says though Ghana does not have enough documentation on the sex for fish practice, it does occur in fishing communities along the coastal towns in the central region.
We can tell that there are some subtle cultural tendencies which contribute to some of these things. Once the people are not captured in educational institutions, then the either hand, they can be easy prey and they become vulnerable. Once you are having unprotected sex, you will be at risk.
He says the girls are victims of this practice as a result of poverty.
The poverty issue must be that the socioeconomic factors are key to HIV transmission. Cultural factors are also key to HIV transmission. Around the coastal area, central region, the introduction of TVET is helpful so that people who cannot do formal education, they can do TVET, and then also supporting vocational activity, in those contexts can help them, engage them, prevent them from being dependent on men because they don't have anything to do and they will not therefore be at risk.
While HIV prevalence in Ghana was nearly 2%, thus 1.68% in 2020, research estimates that HIV prevalence among fishing communities is 4 to 14 times higher than the national average for adults in some countries in Africa, Asia, and Latin America. Research also shows that women engaged in transactional sex are twice as likely to be infected with HIV. Dr. Isiado says several reports from the central region in Ghana have shown a link between the sex for fish phenomenon and higher HIV prevalence in these communities.
HIV is still real. There are about 350,000 people living with HIV now in our country, and about 6% to 10% of these are children. We should protect the older children, the adolescents, who are vulnerable to a very large extent. Protection is a responsibility on the adults, a responsibility on the part of institutions. Everybody must take it as a personal responsibility. We must actually elect to contribute our quota to make sure that we can be able to prevent HIV in adolescents, because these are going to emerge very soon into adulthood. It is more difficult to live with HIV when you are young because you have to take medication for a longer time.
To break the cycle, the Safe Space Initiative, a child's rights program under the UNFPA in fishing communities, has targeted both in-school and out-of-school adolescent girls through education, community engagement, and advocacy on their sexual and reproductive health rights.
We also work with the Ghana Health Service to ensure that skilled health officers go into the community to provide health education to adolescent girls who do not really know what they are involving themselves in by accepting offers from men in the name of addressing a particular challenge they have. So this has also gone a very long way in terms of addressing the issue of sex for fish. These engagements have made them very assertive.
The team lead for International Needs Ghana, the implementers of the Safe Space Initiative, Mr. Isaac Arthur, says girls must be empowered to fend off sexual exploitation.
Usually when some of these offenses occur, you find families, traditional leaders, religious leaders intervening and trying to address the issues amicably or settle them out of court. And we feel that this is against the law, and there must be a lot of sensitization to help traditional leaders, religious leaders understand the fact that they are acting against the law. And as much as possible, when people are brought to book as well, there shouldn't be any political interferences.
He says with the Safe Space Initiative in the selected communities in the Central Region, most adolescent girls who have been sexually abused through these practices have been supported.
Most of the out-of-school girls are free and available, and as a result of that, we have engaged them in some apprenticeship and others enrolled them in school after a series of counseling. And this has also contributed to them being taken away from the effect of these abuses that come to them or they face on a daily basis.
The Safe Space Initiative has altered the climate and improved the sexual and reproductive rights of girls in these communities, empowering them with skills that help them to be confident, assertive, and empowered to fight any form of sexual exploitation and abuse. Maybe Sophie Champo, GBC News, Accra.